from the Channel 5 News. Today we're going to be talking about fluoxetine hydrochloride. Most of you may know this drug as Prozac. It's an antidepressant and it was the hottest drug in history. The U.S. Drug Administration approved it in December of 1987 and it took the nation by storm. It was the icon of an era, if you will. The drug seemed to be a chemical miracle. It's an SSRI medication that targets your serotonin and is prescribed to nearly 2 million Americans. According to the FDA, many controlled studies were done on fluoxetine to improve its understanding of its psychiatric impact. Based on a group of 9,087 individuals who participated in 87 different randomized clinical trials, the drug was confirmed as an effective treatment for clinical depression. It may be safe for elderly patients as well as pregnant women. It is also said not to have an effect on those who are already suicidal. Patients with menstrual pain and those who suffer from PMDD as well as bulimia nervosa are also said to use Prozac as an effective treatment. Once again, these are just our findings according to the FDA's reports, and in no way are we encouraging the consumption of this drug without further consulting with your physician. This is Miranda signing off with the Daily News Report. Now back to you, Ramon.
Hi, Dr. Ramon. I have a patient in room 2 that she has a laceration on her right arm, and she attempted a suicide. She have the signs of depression. Here's are her vitals. I prepped her, and then she's waiting on you.
Okay.
I can't even remember when it started. It's like the feelings just set in. All I wanted to do was get my LVN license. And here we are now. Friends and family were concerned. And after I tried to commit suicide, it was time to get some help. I went way too far this time.
Hello, good morning. My name is Ramon. I'm the doctor. What's your name?
Bella.
What happened?
I'm just so stressed out, and I just felt like I couldn't do it anymore. Like I just can't do this school stuff anymore. Like I'm so stressed out.
Okay, the school is kind of stressful for you right now?
Mm-hmm.
Okay, what part of the school is it stressing you about?
It's just everything from the assignments. Like I just can't do it anymore. I just can't be here anymore to deal with it. Like it's too much.
Okay, I see. Okay, I see that you have an injury in your right arm. What happened?
I just wasn't feeling good. I don't know. I don't know what I did. I don't know.
Are you been eating lately?
Not really.
Not really. Okay. Are you been sleeping? No? How much do you sleep a day?
I don't know.
You wake up at night?
Mm-hmm.
Okay, it's okay. We're gonna take care of you. I'm just gonna ask you a little bit few questions, okay?
Okay.
And that way we can make you feel better. Okay.
Few moments later.
Okay, I came back. Thank you for waiting. Okay, so I've been talking with the psychiatric department, and we agreed that we're gonna give you antidepressants. Do you know what is that?
Kind of.
Okay, so we're gonna prescribe you fluoxetine hydrochloride. It's more known as a Prozac.
Okay.
Okay, so I'm gonna discuss with you the side effects of the medication, okay?
Prozac is known as an antidepressant. It can be used for depression, acute obsessive compulsive disorder known as OCD, panic attacks, eating disorders such as bulimia, or premenstrual dysphoric disorder. How does Prozac work? Well, it selectively inhibits reuptake for neurotransmitter serotonin by CNS neurons and increases the amount of serotonin available in the nerves. Elevated serotonin levels may result in an elevated mood and consequently reduce depression, obsessive compulsive disorder, and diminish panic attack symptoms, as well as relieve premenstrual dysmorphic discomfort. Prozac can help improve your mood, sleep, appetite, energy level, and it may help you restore your interest in daily living. It will decrease fear, anxiety, unwanted thoughts, panic attacks, and it can also reduce the urge to perform repeated tasks that interfere with your daily living. It may lessen premenstrual symptoms such as irritability, increased appetite, and depression. It may also bring relief to patients with bulimia, decreasing their binging and purging behaviors. Side effects include nausea, drowsiness, dizziness, anxiety, trouble sleeping, loss of appetite, sweating, blurry vision, gastrointestinal disturbances, but more common, hives, itching, skin rash, inability to sit still, restlessness, and less common, chills, fever, and joint and muscle pain. Please notify your physician if you're experiencing any adverse effects, including anxiety, dream disturbances, emotional liability, fever, headache, neuroleptic malignant syndrome, seizures, serotonin syndrome, arrhythmias, hypotension, prolonged QT interval, ventricular arrhythmias, hypoglycemia, melena, altered platelet function, unusual bleeding, hyponatremia, and especially suicidal thoughts. Your primary physician or doctor should be aware of nursing implications, including monitoring the patient's mental status, such as mood, thoughts, and presence of suicidal thoughts, psychiatric symptoms, including anxiety and depression that can worsen in some patients, monitor with other medications, avoid the use of alcohol, do not take while pregnant or breastfeeding. Your provider will teach you how to take fluoxetine properly, taking 1 tablet of your prescribed dose in the morning every day at the same time. Do not stop taking fluoxetine abruptly because it may increase your risk of withdrawal. Do not take while pregnant or breastfeeding. Notify your provider if you have any noticeable different symptoms than usual, and it may take several weeks to notice a difference. Dosage depends on prescription, but for depression, 20 to 80 milligrams once daily in the morning should be taken. Your daily dose should not exceed 80 milligrams. After 4 weeks, your doctor will check your response and the dosage may be increased.
Please consult with a provider before taking any medications. Antidepressants can increase the risk of suicidal thinking and behavior in children, adolescents, and young adults with major depressive disorders. Closely monitor patients of all ages for clinical worsening and emergence of suicidal thoughts and behavior. When using fluoxetine hydrochloride, refer to the box warning section of the package insert.
Depression hurts, but Prozac helps. Thanks to Prozac, I feel better. Prozac.